Really, the focus of biomed is to understand somebody's physiology. It's not to understand your disease. It's not to understand your symptom, but it's to understand, how did you get there? What happened in your past, or in your preconception even, or past generational? What was going on back there that has allowed whatever the entity is, whatever the energy is, to be passed down to this point in time, that now at 53 years old, you're coming and you're telling me you have breast cancer, or you're telling me you have, ulcerative colitis, or, whatever or you have osteoporosis. I said, did you think you just got it? I said, osteoporosis is a 30, 40-year process.
This podcast is called Reconditioned because this is the place where you'll learn how to truly recondition your entire life. Where other wellness podcasts or platforms focus on one particular area of wellness or inner growth, Reconditioned is a one-stop shop for all of it, so that you can get all the information you need to heal and up-level the physical, mental, emotional, and spiritual aspects of your life in one place. Because that's what I needed when I was healing from the arthritis I had from the age of 2 that left me disabled by 18. I got myself to a place of complete wellness after a very long journey of immersion into the world of healing, where I learned how to heal the whole self. My purpose now is about bringing that to you, and my Rise membership is an extension of that. For women who want to take their wellness and growth to the next level, there really is nothing out there like it. You'll be part of a global community of like-minded women with access to 14 modules that literally take you through everything you ever need to learn in order to bring your life to a place of balance and abundance. With group coaching calls with me, personalized support, community book club, and so much more. Rise becomes part of your life, your lifestyle, enabling you to thrive in the ways you always dreamed, with me right there beside you, championing you through your journey. It's not always open for enrollment, so if you're hearing this now, it's open and ready for you to enroll. Just go to the show notes for the link or visit laurenvakneen.co.uk/rise. Welcome back to Reconditioned with me, Lauren Vakneen. Thank you so much for being here once again. And today's episode is with Dr. Dickson Thom. And the reason I was so excited to speak to Dr. Thom was because he runs a clinic in Scottsdale, Arizona, that is the clinic that I have visualized and dreamed of my entire life. It is the clinic that does all the diagnostics for everything, like so much further than blood tests and x-rays and anything we can imagine. They're testing the lymphatic system. They're testing biological dentistry. They're testing your I've already said lymphatic system. They're testing things that we wouldn't even expect to hear about. All sorts of diagnostics that give them insight into your nervous system, for example. What's your nervous system doing? Because that's the first place we need to start. And this is the clinic that needs to be built everywhere. This is the kind of treatment that needs to be available, in every city across the world. And we need to get to a point where it's accessible so that more people can afford it, so that everyone can afford it, so that we can find ways to make this healing work accessible. Because how are people meant to get to it if it's only available for the people who can afford it? So I am absolutely very excited for you to listen to what his clinic is about. And that was just kind of a personal side note of my passion for bringing this work more into the mainstream, and hopefully one day having these clinics all around the world and having them accessible to everyone. But like he says, and like I always say, and if you're a regular, you'll know I always say this, it is the free things, the everyday things we can do ourselves, the getting out in nature, the walking barefoot in nature, the drinking good water, eating good food, breathing, meditating, keeping good thoughts. Those things are free and available to everyone. So, all that just to say that this episode was so interesting. If you are suffering with any chronic health problems at all, or know anyone that is, then this episode is really eye-opening for the kind of treatments and the kind of ways available to us to heal, and also how he sees healing, how he sees the organism that is the human body, and why he doesn't treat the disease. So it doesn't matter if you come to him with pancreatic cancer or diabetes, he's going to treat you in the same way. Obviously with variations depending on your diagnostics, but the idea is that he's treating the person, not the disease, which is what homeopathy does. And he uses homeopathics in his treatment as well. So super interesting conversation. I hope you'll enjoy it. And as usual, if you know anyone that this could benefit, please share this episode with them so they can benefit from it too. And thank you for being here. I appreciate you. Dr. Dickson Thom has been practicing medicine for over 50 years and has lectured extensively for over 40 years throughout the world. His first postdoctoral degree was obtained from the University of Toronto in the Faculty of Dentistry in 1974. Following that, he received his first Doctor of Naturopathic Medicine degree from the Ontario College of Naturopathic Medicine in Canada in 1986. In 1989, he completed a second degree from National College of Naturopathic Medicine in Portland, Oregon. He served as Dean of Naturopathic Medicine at NCNM and taught there full-time as a professor for more than 25 years. In 2009, he received the prestigious honor from the American Association of Naturopathic Physicians called the VIS Award for his commitment to the healing power of nature through his work, life, and community service. He is the author of several books, most recently the book called Begin Again: Trauma, Disease, and Healing the Brain Protocol and Biological Medicine. He believes health is a reflection of physical, emotional, spiritual, and energetic balance. So, Dr. Thom, we are very aligned in that aspect, in what we believe medicine actually is. So welcome to Reconditioned.
Well, thank you very much for the invitation. I look forward to it.
So before we start, and I obviously have so many questions and so many places I want to take this, but I always start by asking my guests the first question, which is, what have you done so far today to support your wellness?
I start every day by getting up, feeding my dogs, letting them go outside, and then as soon as I do that, I put my shoes on and I go for a 3-mile walk within the area. And I have drank about 16 ounces of water today. And I've done some meditation and I've done some deep breathing.
Wow.
That's how I start every day.
A great way to start the day.
Yeah, indeed. Today was, I didn't look, but I'm up to consecutively day 867 or so consecutively that I have started my day like that for the last 867 days. And I can tell you exactly where I was 868 days ago. I was in Portugal and I had COVID and I was too ill to go out and walk. Otherwise, I would be over 1,000 days consecutively.
Okay.
Yeah.
Well, I always think that the way we start our day really does kind of impact how the day goes. So I always like to ask that question.
Well, I live in a place in Arizona that's pretty nice. So it's, we don't technically winter. So it's fairly easy even in July and whether it's July or whether it's in January to get out early in the morning. And I'm a morning person. So I always love to start the day that way.
Yeah. So I want to go back to kind of your origins, just because it gives, first of all, I read out that whole bio because I think it gives context to your expertise and your knowledge and your background.
Right.
But could you take us through that background, why you started doing what you do? And when you went into medicine as a young medical student, did you ever envision where it would end up for you and what led you down the path of a more naturopathic approach?
I always had an interest in medicine. In fact, I always said, my parents said probably when I was 10 years old, I said, "Oh, I'm going to be a dentist." So, I did what it took to get into dentistry. And then when I was in dental school, I met my now wife, who I've been married to for 53 years, in dental school, and she had just gone over mono. And so in the first few years of marriage, she had a number of health problems as a very young woman. And sort of like in your case, she went through the conventional medical system, didn't get any results. And after a number of years, I discovered that, and by now I'm practicing dentistry for a number of years. I discovered a physician who said, there's probably another approach than just trying to take this medication or that medication in general. which interested me in the alternative approach, we'll say. And so I was living in Canada at the time, and so I literally went to the library and started reading about alternative. And so we're talking in the 1970s. There wasn't a whole lot. One of the things that I did read was that mercury was not good. And so I was one of the very first people to start to advocate the removal of mercury in 1970. And I was the president of my association at the time, and I got blackballed from the association. I lost my license because I was promoting not placing amalgam fillings. So I was like, oh, I have a young family. I've only been practicing for about 10 years at that point. I said, what am I going to do? Do I comply and say, okay, I won't talk to people about removing amalgam fillings, etc. So anyway, it led to a line, and it got to a point I said, just can't do this anymore. So I said, I have to go back to school. I went back to school to become a naturopath. And so I practice, I've been practicing as a naturopath for now 38 years. And about several years into practicing naturopathy, which I definitely believe is a much preferred way of looking at health, I was introduced to the whole idea of biological medicine, which was, I say, is the next step beyond naturopathic medicine. The next step in the aspect that it started to use, I'll say, technology. Naturopathic medicine is very rooted, for a century and a quarter or so back in the late 1800s in general, which is sort of its conventional model, but it uses, we'll say, more natural substances. When biomed was introduced to me more than a quarter century ago, it started the introduction of, we have now technology where we can actually make measurements, electronic measurements, we'll say, of things that you're not going to get from a blood test. You're not going to get from taking an X-ray. You're not going to get from an MRI or a CT, et cetera, et cetera. So that launched me into looking at, the different models of medicine. So we look at integrative medicine, we look at functional medicine, looked at naturopathic medicine, which I was practicing. And I said, I think they're all still missing a bit of a piece of the puzzle. And that's being able to assess people sort of on an ongoing basis, and not a one-time thing, come for your annual blood test and say, oh yeah, your blood tests look fine. But they don't really tell you the answer. They didn't tell me what was really happening to people. And then I met a physician, a French doctor, Dr. Gerard Guinaud, who was in Lille, France, who to me taught me that medicine isn't about giving things. It's about doing things. It's about what you do on an everyday basis that will have a much greater impact on your health than simply, here, go to the doctor, you have high blood pressure, take this medication. And many of my patients take medications, and so I'm not against people taking medications or doing whatever they're doing. And the question I always ask them is, why do you have high blood pressure? Why do you have dysmenorrhea? Why did you get rheumatoid arthritis? So medicine has a way of treating the symptom, but they do not have a way of treating the problem or really understanding what the problem is. So what I've done in teaching all around the world is I keep asking people, why do you have it? Why do you think you have that problem? Why you? People say, well, I was exposed to mold, or I have Lyme disease. I said, well, if the same tick bit 10 people, do you think they'd all have Lyme disease? No. Why not? Why doesn't everybody get Lyme disease? So it wasn't about the bug. It wasn't about COVID. It's like, well, I'm sensitive to gluten. Why are you sensitive to gluten? Well, I have a genetic problem. Why do you have a genetic problem? So, it became to a point that I never was at the end of asking the why. And the more you ask the why do you have it, people start to realize that they have the intuitive answer to their problem. You just have to ask the right question, which in many cases takes a long time because patients are so used to just coming in and saying, well, I have this symptom. I have a headache. I have a runny nose. My stomach hurts, or whatever it is. And you can say, well, you can take this homeopathic, you can do this herbal remedy, or you can take a nutraceutical and it gets better. I said, well, stop it then. Well, then it comes back. I said, well, then you haven't treated anything. You've made it feel better, but you haven't really addressed the real problem. where I see biomed is sort of, I think, in my opinion, the preferred way to approach medicine is a biological doctor never stops asking why. What is the next question? I use the analogy of to my patients of saying, your health to me is like a 1,000-piece jigsaw puzzle. Everything you're going to tell me today is a few of the pieces of that puzzle. My job is to help you find all the rest of the 1,000 pieces. When we have the 1,000 pieces, which may take several years to get there, which often is the case, which a lot of people say, oh, it's going to take forever. I said, well, you're going to be here forever or for a long time. We have time. And it's not like you won't feel anything until the end of the journey. And progressively, you will continue to feel better. And so, I take great pride because I practice for all these years that many of my patients I've seen for 20, 25, even 30 years. And they say, well, haven't you figured out what's wrong with them yet? I said, no, we don't talk about the same things 30 years after the fact. In fact, they're 30 years older, but they'll tell you they feel 30 years younger because of the fact that they've learned self-care. And my emphasis is more on what do you do for yourself more than what I can do for you. Yes, I can support you and I will support you. And I'll support you with energetic therapies, whether they're with a machine or with a homeopathic remedy or an herbal remedy, or whatever is the most appropriate for you. But if you're not taking care of yourself, if you're not getting a proper sleep routine, if you haven't found a diet that is the most appropriate for your specific situation, or you're not moving your body on a regular basis. So I have, 6 principles that I tell every patient that, because what I believe is biomed, really the focus of biomed is to understand somebody's physiology. It's not to understand your disease. It's not to understand your symptom, but it's to understand how did you get there? What happened in your past or in your preconception even, or past generational? What was going on back there that has allowed whatever the entity is, whatever the energy is, to be passed down to this point in time that now at 53 years old, you're coming and you're telling me you have breast cancer, or you're telling me you have, ulcerative colitis, or whatever or you have osteoporosis. I said, did you think you just got it? I said, osteoporosis is a 30, 40-year process. Yeah, we should have started treating it 30 years ago. Now you're saying, well, what can I do about it? I said, well, we can support that, but I still would like you to understand that 30 years ago, this is the type of things that started this process. So that's sort of what my approach has been. I found it to be incredibly successful with patients. There are some patients who are not sort of ready for that approach, but when you practice for a long time, like I have, which is why I think, in fact, I just got an email just 2 days ago from a patient I had not seen in 12 years. It's like 12 years. And it's like, it was actually from her dad, which was one of these, like, you totally forget about these. And he was so appreciative that 12 years ago, 22-year-old daughter was so ill. And he said, I can't tell you the difference that her life is. She's married. She's got 2 kids. She's very successful in her business. This is not the person that you saw 12 years ago. It's like, well, it's very satisfying to know that these stories. And, I have to say that's sort of the stories that I have in my practice for what's going on. And so that's probably much more long-winded than you wanted, but that's sort of how I get into this and why I'm so passionate. Still 50 years practicing medicine. I just love it. I just couldn't imagine not doing this because people are eager and wanting to know that there is another approach other than just taking a pill, which helps them feel better, but it never really cures their problem. And the doing is more important than the taking something.
I know. Interrupting an episode with an ad is so annoying. I know. But guys, I want to ask you not to fast forward this and listen for just 2 minutes, because there is a huge element of health optimization and reducing risk of illness that most people don't even realize. You need to be reducing artificial blue light in the home and get targeted red light on your body. The reason is because when the body registers blue light, your brain, based on evolution, assumes it's early daytime. But our brains in 2024 are registering blue light from our light bulbs and our screens at literally all hours, prompting our bodies to produce cortisol, the stress hormone, as well as other hormones we just shouldn't be producing at night. This affects our stress and anxiety levels, and it stops the cells in our bodies being able to repair and regenerate at night. And let me be clear, when our cellular health is compromised, we literally cannot stay healthy. And our amazing partner, Block Blue Light, have created some incredible light bulbs that allow you to switch between settings and have only amber light at night, which is what we kitted our whole house out with when we renovated a few years ago. And if you do need to work after dark, like I have to sometimes, Block Blue Light also have amazing blue light blocking red light glasses, some that fit over your usual glasses, and they can even custom make glasses with your prescription. They also have some of the most powerful and effective red light machines on the market, using photobiomodulation to help keep the mitochondria in your cells healthy, something we cannot be healthy without, as well as helping your body to produce more collagen for bones and joints and to keep skin looking great as you age. It also supports pain and recovery, and red light is said to reduce the risk of Alzheimer's because of how it impacts brain health. We can't control everything happening in this modern world that affects our health, but my personal motto is to mitigate where we can and put in place everything we can for the things we can control, and blue light is one of them. You can get a 10% discount across the range by visiting blockbluelight.co.uk and using the code LV10. Okay, back to the show. Yeah, I completely agree. And I agree with, everything you said about, the illness started 30 years ago and people kind of want to live these lives of convenience, eating the convenient food and doing the convenient things and not doing the things that aren't so convenient. And then and I always say, then complain when they get sick and are almost shocked when they get sick. But it's like, why are you shocked? What did you do to prevent the sickness? And then they want a quick fix. And so, I'm always an advocate for preventative medicine, preventative care. So, just love kind of everything you said about, work on it 30 years before and you won't have to deal with it 30 years after.
Right.
What I'd love to get a deeper understanding of is, and I know that my audience will too, is your clinic and how it works, because I've heard such incredible things about all the treatment options available that people can come and stay for a week or 2 weeks and have a real kind of concentrated, intensive time there to get things started. But what I also love about it is that it, like you said, you teach them how to do the self-care. So you send them away with them understanding how to keep themselves in a state of homeostasis, which is the key. Because, when I was first, when I was as sick as I could possibly get at 18 and I had no use of my joints, I found a doctor in Israel who practiced a therapy called IPEC therapy, integrated physical emotional clearing. And it was amazing. And within 3 months, I was so much better and everything changed. And after, 5 months, I came home and, I was 20. I'd lost like 3 years of my life, basically.
Right.
Missed out on going to university and all the things that my friends did. So I just wanted to go out and party and work and do all the things I hadn't been able to do. And then obviously the arthritis came back. Now, the doctor was amazing. He was incredible. But I wasn't ready to take on the learnings for myself. So when the arthritis came back at 21, everywhere, it was the biggest blessing, because that was my kind of initiation into, okay, you've started learning that you can't rely on allopathic medicine, but you haven't yet learned that your health is your responsibility and you can't keep outsourcing it. So what I love about what you do is people do need to come to a place like yours and have all these therapies and modalities and things that you can offer to get them out of that acute stage, but then you're sending them away with how to keep themselves healthy. So what I'd love to know is what happens in the clinic. How does it work? It sounds completely amazing and revolutionary.
What I typically have found is many people are doing all the right stuff, all the things that we've talked about, but they're not really achieving the results that they would like. And what I find is it ends up being that their nervous system is not in the right balance. They spend more of their time, the treatment is even keeping them in a sympathetic place. And you don't heal when you're in sympathetic dominance. You only heal when you're in a parasympathetic state. So sometimes what may seem to be the best treatment may not be, because it actually is contributing to unwellness as opposed to allowing them to heal in a parasympathetic state. And so maybe instead of doing, ozone, which would be a great treatment, maybe they just need to be on a sound bed, or do more meditation, or do yoga. And that may actually have a more positive effect for their healing than, we'll say, a more aggressive type therapy. And the value of the diagnostics is to show people that, and to make them realize that these are the types of things that would be the most beneficial for you on your healing journey, and which becomes the at-home thing. So that's really where I think the diagnostics have the greatest value. It shows you where you should focus your energy, and you should focus the types of therapies that would be the most beneficial for you. So when patients come in, the first 3 hours or so of their indoctrination in the clinic is that we do what we call in-house testing. And so the test that we're doing is a bioimpedance analysis, which is very simple analysis, just looking at straight body composition. Then we do something called heart rate variability. The unit that I use is specifically Nerve Express. And what it tells me is how functional, or how well their nervous system is dealing with their world. How their nervous system is dealing with stress. And people are generally shocked that say, well, I'm not stressed. I said, well, I'll show you that you are. It's very revealing. We do also contact regulation thermography, which basically tests about all 12 organ systems. It tests about 20 different tissues in the body. And we can also tell what happens under stress, what happens to your organ systems. Do you know what happens, when you feel, and people think stress is, some big event. I said, the first stress that you experience every day, what do you think that is? And I said, well, I don't know. I said, getting out of bed, that's your first stress. I said, what? From lying to standing. So as soon as you stand up, your brain says, uh-oh, you're not safe anymore. You must be standing up to prepare to defend yourself. So you literally go into flight and fright. You go into a sympathetic dominance. How are you going to counteract that with your parasympathetic state in general? We also do a Zytoscan, which is another way to basically do a bioscan of all your different organ systems and all your different tissues. I do a quadrant test to be able to determine which quadrant of your, as we divide the body in four, which quadrant potentially is the area that has the most distress. And we also do a digital pulse analysis, which will give me an indication of how well your cardiovascular system is responding to everyday stressors. So after they've done those particular tests, I then meet with the patient for an hour, sometimes an hour and 10 minutes, and I basically explain every test in detail to them. And not 100% of the patients will say, why hasn't any other doctor ever told me this information? You don't get this information from a blood test. You don't get it from an X-ray. You don't get it from an MRI. Which we're actually doing real live testing, showing what your nervous system does, showing what your organs do when they're under stress. Once we've made that determination of which particular area of their body has the most challenge, per se, for that individual patient, we have in the clinic probably 15 or even 20 different types of machines, we'll say, that we can basically direct them to. So if a person, if I feel that the area that we need to start with is their lymphatic system, we could suggest that they do flow presso. We could suggest that they get a manual massage. These are all done in the clinic. Maybe they will do an ST8, or maybe they will need a foot bath because their energy is so low and their electrons are so low. So we need to drive up their electrons. Invariably, we find that many times, depending on their problem, they're dehydrated. And they say, well, I'm not dehydrated. So we'll do IV therapy, and we do IV therapy with nutrients. We'll do IV therapy with ozone, whatever is the most appropriate. Or we'll do an oxygen therapy. We'll do a HOCAT therapy that has basically 10 different therapies all at the same time. We may suggest that they do some form of cleansing. So they may be doing a colonic of some sort, or we'll be doing an EWAT type treatment where they're breathing 90% oxygen while standing on a stair stepper. So what we do each day then, so they're there a week, 2, 3 weeks, depending on what their issue is. Each day I meet with the patient. How did those treatments go? Oh, this treatment, I felt wiped out. I said, okay, then we need to put you on the sound bed first to sort of get your body more into a parasympathetic state so you're more acceptable of what's happening. Oh, that one did really well, but it stirred up. I got a headache. Okay, so we need to do more detox. Okay, let's do an EBU today. So we'll do an EBU treatment for them today, or maybe we'll do a 10-pass ozone treatment. So every day the treatment is individualized to basically how they responded to the treatment yesterday. And generally by day 3, they say, I think I just got run over by a Mack truck. I said, I am exhausted. I am so tired. And all I do is sit here. I said, yeah, what we're doing is we're asking you to run a marathon without any training. What I'm doing is waking up your physiology. And so what I'm doing is giving you a head start on what you're going to need to be doing once you go home. And when you go home, I'm going to give you all the tools, or I'm going to make the suggestions for all the tools that you need to do on an everyday basis. Because from a physiology perspective, what every patient needs, when we look straight at physiology, what does the body need every single day? What the body needs every single day is oxygen. How do you get oxygen at home? You learn how to do deep breathing. You learn how to move your diaphragm. You learn how to basically breathe 5, 6 times a minute instead of 16 times a minute that most people have. We know that in order to fire every cell in your body, every physiological reaction, you need electrons in your body. In the office, we have MagnaPulse, we have Nano V, we have other types of electron producing machines, the foot bath. Well, you don't have that at home. But what you do have at home is the ability to walk barefoot. Walk barefoot on grass or on sand to pick up the natural electrons from the earth. If you live, fortunately, near water, you can go and walk in the water. You can be near a waterfall and pick up, 100,000 negative ions per cubic centimeter, per se. And if you don't have that, you can get a grounding mat, where when you're sitting at your desk at your computer, you can put up your bare feet on a grounding mat. You can put a grounding mat on your bed, for example. It's every patient who comes to the clinic, without even asking them, the first thing I say, I guarantee you one of your problems, you have congested lymphatics, because everybody does, just because of the nature of somebody who has an illness, unless you have an acute elbow, or an acute injury. Any chronic illness has a lymphatic. Well, how are you going to move your lymphatic? Well, we're going to teach you castor opex. We're going to teach you about dry skin brushing. We're going to teach you that you need to move your body on an everyday basis, and whether that's stretching, yoga, tai chi, going for a walk, whatever. Most of my patients, I do not have them go to the gym, because they're not ready to go to the gym, because it's actually too stressful on their body based on the shape that we find initially. Minerals are historically low, so before somebody leaves, we nearly always do minimally. We do a Myers or something similar to that, where we're basically giving them an influx of, but that's where I talk about diet. Where do you get your minerals in your diet? By different colored fruits and vegetables. The research now says that the goal is 10 different colors of food, mostly fruits and vegetables, significantly reduces your risk of heart disease, significantly reduces your risk of cancer, autoimmune disease, et cetera, et cetera. And now we need to make sure that you're properly hydrated, drinking the proper amount of filtered water for your body composition, et cetera, et cetera. So those are everyday tools. That's going to be your homework that you're going to have to devote to your self-care every day. And so by the time that the patient leaves, we have basically started the process. We have supercharged their oxygen. We've supercharged their electrons. We have got their lymphatic system moving. We've taught them the type of foods that would be the most beneficial for them. We basically have ensured that the amount of water that they're drinking is going to adequately supply their intracellular to fill up their intracellular water. Now their job is to do it. And in addition to that, we will give them energetics, homeopathics, herbal medicines, nutraceuticals. But the real treatment, as you discovered, is not taking things. If you don't do the work, it's just going to come back because you're going to get tired of taking stuff. You have to learn how what you needed, the self-care that you need to devote every day to. And I say part of your job is this is part of your job. And for people who are really ill, let's say cancer, I said, this is your full-time job. You need to not work for a while because you need to be doing something self-care wise on an ongoing basis. And you can be doing chemo or radiation or whatever you've done in addition, if that's your preference per se, because I'm not anti anything in conventional medicine. If you're doing what I'm going to suggest, you're going to find you don't need to do that other stuff. But I'm not going to tell you that. You're going to figure that out on your own. The most common is like when somebody comes in with high blood pressure. I said, one day you're going to find that your blood pressure is so low that when you stand up, you're dizzy. I said, oh, what am I taking this high blood pressure medicine for? I said, that you answer that question per se, because when your body, works more efficiently, you won't need to take high blood pressure med. You won't be having a migraine headache, twice a month because your hormones are out of balance. I mean, but this is not something that happens by just taking something, 30 days later, you're better. You're not. This is, as you found in your journey, it takes years in many cases to change something that's been going on for years. In some cases, it's been going on for generations. So patients leave the clinic after whatever time frame that they've been there, and then they will come back for a tune-up. We'll say it could be in 3 months or 6 months. And of course, in the meantime, we will have whether we'll do video calls or if they're local, they'll come into the clinic, and recheck things. And then we recheck them again. Where are you now? How are things going? And what you start to see over time, although we almost don't need the test because the patient is telling us, wow, I feel so much better than I did, 3 months ago or 6 months ago. I know we're going in the right direction. And so it's the unusual patient that says, I feel nothing. I mean, and if that's the case, then I reevaluate and I said, okay, I really missed something here. I missed some piece of this puzzle, a big piece of the puzzle that I wasn't thinking about. But the amount of years that I practice and the testing that I do in the office, it doesn't happen very often anymore because I get a pretty good picture of what really is going on. And eventually what we get to is dealing what happened 30 years ago. Like what happened 30 years ago? And in fact, where I'm going to be in New York this weekend, and I'm going to be doing a seminar on the effects of trauma in your past and how much effect trauma has on what I call learned perceptions and how you respond to circumstance and situation. That is the reason that you have the present health problems that you're experiencing in general. And then using something that I actually developed, a whole protocol, which is what I wrote my last book on. How do we heal trauma in addition to just the typical things that people do, but I actually do it with energetics. I actually recreate neural pathways. I'm able to write over old pathways of old patterning that people have done forever, and I've been doing that for 25 years, over 25 years, and with hundreds, probably the thousands of patients that it changes their life. And they start to realize that's why I have this. That's why I had migraine headaches. That's why I have dysmenorrhea. That's why this particular problem happened per se. But that's a lengthy process. It's challenging because what we're doing is we're putting patients through things that they experienced as a child that may not have been very pleasant. And I'm not just talking somebody who has child abuse or, some of we call them, the big traumas, the big T's. It's the little T's. Your parents got divorced, and they're in the military, and you moved all the time. You lost your friends. Said, yeah, it happens. Those have a pretty significant impact on you, and
Mm.
you don't realize them. And as you add all those traumas up, they fill your cup up, and then you don't have any room for anything else to happen in your life. And so your body starts saying, well, it's like, I'm bringing the doorbell. Are you going to answer the door? You don't answer the door. So you have a headache. So somebody takes the Tylenol. So the question is, oh, and what happened? Oh, got better. Oh, so you have a Tylenol deficiency. Is that why you got better? No. Well, then that's probably not the solution. What all you're doing is covering up your symptom. But if you really want to find out what the problem is, we will help you do the investigation, and I'll show you physiology wise, whether it's electrons, whether it's your lymphatics, whether it's, you need to add more oxygen, whatever it is. I'm feeling very comfortable that we'll be able to show you what that is. And so that's a pretty exhaustive approach in the clinic. And that's why by day 3, patients feel that they're beat up, because we are revving up a physiology that's been pretty stuck. Now, it doesn't mean that that's bad. It just means that, we are working, because and if it's only a week, I might only have 5 days, basically, to show them what can happen. And usually, if even a week, by day 5, they said, wow, I feel a whole lot better now. I said, yeah, remember 2 days ago? I said, yeah, because now we've done a treatment the last 2 days to allow your body to get past that particular point in time. So that's what the experience is when people come to the clinic.
Mm. So many questions for you from that. Firstly, I'm interested to understand your process for the trauma healing. You mentioned an energetic approach to rewiring the neural pathways in the brain. That's a big part of my own work as well. What is your process and your method for that?
So I use specific homeopathic therapies, and what I look at, and there are 7 phases of development that we go through, going back to Chinese medicine and the work of Steiner from anthroposophical medicine. So we have basically from the time of conception to 18 months, we have from 18 months to 7 years, from 7 years to puberty to the end of the teen years. Then we have the early 20s, and then we have the 20s, and then we have senescence. So we'll say post-menopause per se. Each of the different phases uses a different set. There's a different area of the brain we stimulate, because there's a different organ that we need to stimulate. There's a different gland that we need to stimulate, because everything, while a baby is born and you have all the pieces, they're not mature. Our brain doesn't fully mature until our mid-20s. So there's different stages of development. So, when I ask a person about their history, and you find out that, as a patient has told me yesterday, she said, yeah, my mother was quite ill. I was only breastfed for 3 months. I had chronic ear infections. I had chronic strep throat. I took antibiotics, almost monthly. And now you wonder why you have digestive problems. You've never really had your organ system for digestion develop, because that matures. So the first organs that develop are the kidney, energetically, per se. So, we do kidney remedies. I do brain remedies. I do gland remedies. At the same time, I'm supporting immune function. So in addition to remedies, I'm using colors, I'm using sound, I'm using chakra stimulation, per se. I'm having people that do a diet that's almost similar to what a baby would eat at that particular phase. In other words, it's like we're starting over. And so when we get to the next phase of the digestive phase, different organ systems, different part of the brain, a different gland that's involved. And then we get to the pulmonary stage, and then we get to the puberty stage, and then we get to the cardiovascular stage, and then we get to the nervous system stage, then we get to the andropause menopause stage. So there are different remedies for each of the 7 stages. And so patients are given the specific set of remedies. They do that. They do all these treatments and therapies through a month. They come back at the end of the month. We reevaluate. and they'll say, oh, this is what happened. I had this dream, I had that, I had this memory. Okay, we're not quite done this phase yet. So what we're starting to do is uncover it. And so as a child, whatever age it was, they couldn't do anything about it, the whatever that trauma was. But what we can do is we can make them realize what it is. We can literally rewrite those neural pathways. And so the next time that they experience it, which was a big deal because it was their learned perception, um, it's not an issue. One case that comes up often in these discussions, during this, I had a patient remember her actual birth. She actually re-experienced her own birth while doing this process. She saw herself coming down the canal, and through her entire life, there was a smell and there was a color that she disliked. She had no idea why. I don't like this color. I don't like the smell. When she was experiencing her birth, that was the smell in the operating room, and that was the color and she had a very traumatic birth overall. So she came into the world in a very traumatic, and the first thing she smelled and saw was a color and a smell. As soon as she had that revelation, it was never a problem anymore. She said, it's like, I don't know why I didn't like that smell, because she was able to go past it. And that memory that was not, that was very traumatic for her, formed literally at the moment that she was born. And so this is the type of experience that people start to have. One of the most dramatic was a patient who has anaphylactic reactions to roses. And I lived in Portland, Oregon, which is the city of roses. Like, what do you live here? Of all the places to live, you're using an EpiPen, because there's roses everywhere in Portland. Anyway, she came into my office, and I have no idea why I had an artificial rose, but there was an artificial rose for whatever reason in my office. She walked in, saw it, and had an anaphylactic reaction.
Wow.
I said, it's an artificial rose. There's no pollen. There's nothing. You saw it and you reacted. So that was a learned perception, not because it was physiologic. It just her brain said, when you see a rose, you're going to respond, and you need to do an EpiPen to save your life. And so once we got that revelation over, suddenly roses were not causing anaphylactic reactions. So we're able to retrain the brain.
So it's a really extensive process then, using so many different modalities. It's incredible.
That is correct.
What would you say are the most common ailments that people come in for?
Well, the number one is always pain in some organ, and whether it's, rheumatological pain or an organ pain, digestive pain, that fatigue is always there. And certainly since COVID, I would say 75% of patients will say they have anxiety. Some will add the fact of depression to it. So, but because I will say I have general practice, I treat anything and everything. I treat babies from 1 day of age. In fact, I even get involved in fertility, and I've probably had about 150 couples basically conceive children who are told they couldn't conceive children. I don't do anything special, and I'm not doing IVF. I'm just doing homeopathic remedies. I'm doing basic physiology to get their own body. And I say, if the woman has the parts, if you ovulate and you have patent fallopian tubes, and your husband has viable sperm, and that's not a problem, then you can get pregnant. And whether you're 25 or 42, I feel pretty confident that we can help that.
Yeah, and fertility is a big one. I mean, the ones I see the most are, like you say, anxiety, but autoimmune diseases and cancer. Do you get a lot of those?
Yeah, but half the patients are cancer, and autoimmune disease is there. And what's interesting about cancer, back in the day, when I was still in Portland, a lot of naturopaths were a little skittish about treating cancer. So I said, heck, it's just another condition. And when I'm doing BioMed, I said, the name of the disease isn't important. The fact that we're just trying to understand why you have it is the key issue. So I just kept doing it. I said, you keep doing what you need to do. Do what the oncologist says. I'm totally fine with that. If you want to do what I'm doing, we can do them concurrently. It will not interfere with your treatment, and I will virtually guarantee you will have a better outcome. than anything the oncologist will ever say to you.
And do you have people that do come to you though, who, have found out they have cancer and don't want to go down the oncology route, and they
Yes,
have?
I do. I do. And I basically say, this is what I do. I'm not going to treat your cancer because I don't treat any diseases. I will treat
Mm,
you. I treat patients who have cancer, but I don't treat cancer.
mm,
So whether you tell me you have breast cancer or colon cancer or pancreatic cancer, I'm going to support your physiologic processes. And depending the stage that it's at, the success will be the prize. Do patients that I have cancer pass away? Yes, they do. But do they pass away with a high quality of life? 100%. And invariably, what happens in those cases, I've got so many cards and letters from remaining family members saying, we're so thankful and so grateful that, my mother, brother, whatever, had a quality of life right up until the end, per se. And I remember one of my very first ones 30 years ago. He was a veterinarian. He had esophageal cancer, and he'd had surgery, and he'd had to come back twice. And I said, "Why are you here?" He says, "Well, my wife told me I had to be here because I'm dying and I'm told I have a few months to live." I said, "Okay, well, I'll do what I can if you're willing to do it." And his wife said, "He'll do it, whether he likes it or not." Anyway, he lived but 22 or 24 months when he was supposed to have passed away in 3. And his wife and daughter came in one day and said, he saw 2 or 3 grandchildren born. He got to do his love, which was to go fishing in Alaska. I mean, he did things that there's no possible way he would have ever been allowed to accomplish. So his quality of life, even with terminal cancer, was so great that we can't thank you for the support that you gave. And I said, I'm not doing anything special. I just do the same thing. And whether you have rheumatoid arthritis or whether you have cancer or whether you have a migraine headache or whether it's a baby who has colic, my approach is the same.
mm.
It's all based on biochemistry, physiology to make the body work better.
I know you talk a lot about the lymphatic system, and I think the lymphatic system, a bit like the fascia, is very overlooked. I'd love you to talk about the lymphatic system and why it's so important for us to understand it and work on it.
Uh, Great. So the lymphatic system, like the circulatory system, is how the body is capable of removing our waste products from our body to get it out. So, everybody, when people talk about toxicity, they tend to think of the air pollution. They think water pollution. They think the food is polluted. They think mercury fillings. They think mold toxicity, etc. But the most common toxin that we are exposed to is actually self-produced. It's called carbon dioxide, per se. So, the reason that we breathe is less to get oxygen. It's more to get rid of CO2. If you typically were to take a deep breath and hold it, you have enough oxygen for about 8 minutes. However, why do we only breathe once every 8 minutes then if we have enough oxygen? It's because we have to get rid of our CO2, because CO2 is a poison, and literally will poison. So what happens in the cell respiration, and most of the respiration, most of the cleansing of the cell. And so think of the cell doing, so let's say it's a hormone cell. It's making cortisol, it's making estrogen, it's making progesterone. In the action of making that, in the action of making energy, ATP, there's a physiologic process. There's waste products that get built up. Those have to be removed. How do they get removed? They actually pass into the lymph system. The lymph system covers your entire body. We have people are aware of lymph nodes. They're here, they're under your arm, they're in their groin because they're near the surface, but they're actually all over your body, per se. And only in 2013 did they discover that we have a lymphatic system in our brain. It's like, really? You thought it stopped at the neck, and we didn't have lymph in our brain? So the lymphatic system is the goal is, and so if you're literally just lightly scratch your skin and not bleed, but you have this clear fluid, that's lymph. that is full of that is, we have our lymphocytes, which is part of our immune system. So the lymphatic system forms part of our immune system in the fact that it allows the body to properly keep cleansing itself. And we need to do that on an everyday basis. And when is it most active? It's most active during the night, per se, which is why I typically suggest dry skin brushing before you go to bed to sort of start the process, and castor oil packs at nighttime, because that also will start the process of getting the lymph sort of revved up, we'll say, to be able to cleanse during the night. And that's why in the morning, your breath is the strongest. You have to pee, and the pee usually smells the strongest. In Chinese medicine, the bowels move between 5 and 7 a.m. because you dumped all this toxicity into your emunctories, the emunctory being the colon, the lung, or the kidney, per se, or skin even. And people say, well, I'm all itchy at night. The body is dumping this toxicity out of the body. And then the other toxin that we got to get rid of is our emotional toxin. And I think emotional toxicity, which is not necessarily removed for the lymphatics, but it is removed through expression. And crying is a great way to remove an emotional toxin. Being upset and angry, using a punching bag, going into the forest and screaming, we need to get this stuff out of our body, because when it doesn't, it becomes like a cesspool. It becomes like the water behind a beaver dam. It doesn't move. And the more it doesn't move, the more the toxicity builds up. And the very first test I mentioned, our bioimpedance analysis, will tell us, where is the water in your body? Is it inside the cell, or is it outside the cell? And physiology says 2/3 of it should be inside our cell, 1/3 of it should be outside. But almost always they're so close together that I said, without even telling you what it is, I can tell you that your body is holding on to toxicity. I can tell you that your lymphatic system is congested. And I can send you over to our massage therapist who will show you exactly where it is, or I can put you on a machine and show you where it is. And you'll start to realize that when that's moving, how much better you feel. That's why we have you move and castor oil and skin brush, etc., to move this lymph. So it's a part of our immune system. It's how we decongest ourselves. We need to decongest ourselves on an everyday basis. And it's the most active during the night, which is why another reason we need 7.5 to 8.5 hours of sleep.
So interesting. Another one that I'd like you to go into is mold toxicity. I have a lot of people who come to me saying they've got mold toxicity or they've got Lyme. And the two things are, quite interconnected. But I also have people who, might still be living in a moldy apartment and there's nothing they can do about it right now. And I know you said at the beginning, if the same tick bites 20 people, will they all get Lyme? No. So what is it? I'd really love for you to go into mold toxicity and what is keeping people so sick and the brain fog and everything associated with that. And assume someone can't get out of their moldy apartment at the moment. What can they do? And can you go into what mold toxicity does and a bit about Lyme?
So whether it's mold or Lyme, I'll basically say it's the same thing. So I hope this is not too much detailed. The first thing that we have to know is we have to learn, which is basically going back to the old roots of Hahnemann and homeopathy that talked about miasm. Miasm is the simplest way of saying it is how we eliminate. How does the body eliminate when you are exposed to something that's not self? And not self means something that is not normal physiology. So mold is something that's not normal physiology. Lyme, the infection, spirochete is not normal physiology. So the body has to respond some way to it. So the simple way is there's 4 different ways that the body responds based on how well you chose your parents and your grandparents and your great-grandparents, because they pretty much have determined how you're going to respond when you get bitten by a tick or when you live in a moldy apartment, per se. So you can have 2 people living in the same moldy apartment. One will be really sick and the other isn't even bothered. And that's because their method of elimination that they have, that's just the way it is, that they basically have inherited allows them to efficiently eliminate themselves. One of the ways that people eliminate, and these are the people who eliminate very efficiently, are, they'll either get a high fever. So they get bit by the tick, they get a really high fever. The high fever, which is the best immune thing that you could ever do for yourself, will burn up the spirochete, and the person gets better. So you have high fever, or you get diarrhea, or you have a skin rash, and all that lasts, and it's gone in like 2 or 3 days. You get bit by the tick. It's like you didn't even know you get bit by the tick. And then you have another person who isn't as efficient to do that. And so those people, they mount a fever, but it's not very high. So they're not able to totally eliminate the tick bite or the exposure to the mold. And so what's happening is your liver and your immune system is looking at it and say, what is that? I don't know what it is. I don't have enough vitality to totally get rid of it. So I'm gonna wall it off. I'm gonna put it somewhere. So those are the people that we say grow things. So they grow cysts, for example. They wall things off, and whether it's in your lung or in your ovary or in your gallbladder or it's somewhere, they wall. There's another group of people that basically say, well, I'm not very efficient, but I'm going to get rid of this. So we say they poke holes in their system. So they actually develop ulcers. They start to bleed, and they develop conditions that their body is breaking down. And they think, oh, that's bad. So ulcerative colitis, for example, I said, well, we have this irritant. And they say, oh my God, colitis is so bad because these people, their colon is so inflamed, they're bleeding. Well, the body is saying, that's how I'm going to get rid of this toxicity of this mold or this Lyme person. And then the weakest will say, which by definition is a tuberculinic miasm, their immune system hardly works. They hardly do anything. If somebody did a study, my bet would be if you looked at all the people, unfortunately, in the world who passed of COVID, you would find that the vast majority of them were tuberculinics because they weren't able to mount an immune response. And when you can't mount an immune response, of course, your body is overwhelmed, and your organ systems are trying to make your body be able. So your lung starts to fill up, or whatever the symptom is, whether it's Lyme, whether it's fatigue, you get the bullseye or don't get the bullseye rash. So what these conditions do, Lyme in this case, it literally takes over your cellular machinery. So your body is incapable of doing the normal physiologic response. It can't make the right hormone, or it can't make the right amount of energy, or it can't make the right digestive enzymes, or whatever that function of the cell, or if it's a muscle cell or a joint cell, it doesn't behave properly. Then you have something like mold that basically it says, well, mold, it's fungus, mold. Says, well, we're just going to take over this machinery and I'm going to use it for me. So it basically interferes again. So both these things in some way are interfering with the normal physiologic process that your body needs to do. And so people who have long COVID, people who have, mold toxicity and still live in a moldy house, which is a real challenge. And depending on which of these four modalities that you have to be able to eliminate, if you're the one that is the poorest eliminator, unfortunately, you're going to have a very, very difficult time to get better. So I would say, well, all you can do is, if you can't repair the place, go and rent an ozone generator and, turn it on for 24 hours, go out, go away for the weekend, do your best to try and kill some of that mold with ozone as best you can. If you can't, totally do an overhaul and you still have to live there, use ozone in some different ways in your bedroom or where you're breathing. You may have to wear masks and respirators and do those types of things if you physically can't leave the place. And so people always say, well, we'll treat it to get rid of it. When you still have the exposure, it's very difficult for the body to download, to empty your cup, so to speak, to try and get rid of, the amount of toxicity that has built up in your system. But it doesn't mean you can't try. So those patients have to work so much harder. I said, you have to get oxygen. You have to move your lymph. You have to get electrons. You have to make sure you're well hydrated, et cetera, et cetera. So they say, well, it's not fair because, my brother or sister lives in the same building. They don't do anything. I said, that's the deck of cards you got, and you have to play with them. And that's all you, I mean, I'm sorry, I can't apologize that if this is the way it's going to be. You in your case, you had an autoimmune condition. You figured out a way to deal with it. So what you found that medicines don't do it if you don't do the work yourself. And you have to work on all levels, mental, emotional, spiritual, and physical, because they're all a component of the wellness and healing that happens. So whatever the name, what you could call mercury, you could call it cadmium, you could call it a heavy metal, they're all doing in an indirect way the same thing. They interfere with normal physiology, which is really why biological medicine focuses on physiology and biochemistry. And we use our therapies and everything possible to allow the physiology to return to a normal state. And as your physiology returns to a normal state, even if you've had Lyme, even if you have mold toxicity, your body will actually be able to recover, but you have to be patient, because it's not something that, take a Tylenol, your headache goes away. It doesn't happen that way. You're literally having to grow all new cells. All your cells have to be repaired. And we have to create an environment that the new cell is not being reproduced in an unhealthy environment, because every time a cell reproduces itself, if it's unhealthy, that cell is going to be unhealthy too. So that's why it's a lengthier process to be able to deal with it. And so, these patients, as I said, if you can do the grounding, if you can add the electrons, if you can do the deep breathing, and if you can go to a place where you can even do the machines to help that, you'll hasten the process, but it will not be instead of what you have to do at home. Your lymphatic system is obviously critical in all systems, but even more critical in those two specific conditions. Oh, I lost your voice.
It's so interesting that you mentioned tuberculinum. As a personal anecdote, when I was first diagnosed at 2, my parents took me to spiritual healers and homeopaths, and I saw my first homeopath when I was 4. And they took me to the spiritual healer, this very well-known Indian healer who was over from India for, a few days only. And people were trying anyway. They took me to see him. He took one look at me and he said, "You're from the tubercular family." And because he looked at my dad, who has these kind of like bulgy eyes, and apparently that was a sign for that. And
Right.
every homeopath I've ever been to has said, "You need tuberculinum." So it's very interesting what you say about that, because that's always come back around for me, as a constitutional thing.
And so it's unfortunate because you have the weakest ability to recover from something that's, like, say, not self.
But yes, and I used to be. So I used to get sick a lot. And I used to, obviously, I had an autoimmune disease. And so the immune system was always fighting itself. But since I've been in this state of wellness, my immune system is super strong. So though constitutionally I am on the lower end of that, whereas my husband, thank God, my husband is one of these really robust people. His whole family are, they're just robust people.
Right.
And I have come, somewhere, I'd say even further than the middle now, in terms of I don't get every illness that's going around. And when I get sick, it's, a process for my body to eliminate, and I let it happen. And it happens normally. Of all my family, I suffered the least from COVID. So I think that for anyone listening who thinks that kind of these constitutional ways of being are just set in stone, in a way, genetically they are, but epigenetics plays a huge part since managing the levels of toxicity in my life through the food that I eat, what I inhale and ingest, the things in my home, my cleaning products, not having artificial spray like fragrances and any stuff like that. And, the water that I drink and the clothes that I wear and the emotional element, as you said, and, you know, all the things, and having adequate mineral balance, and, you know, knowing what supplementation I need and all the things. And there are many, you know, reducing EMFs in the home. I've enabled, you know, the cells in my body to regenerate as healthier cells, and therefore to allow me as, you know, one organism to have changed, to have evolved into a healthier organism, which then hopefully means that I've passed that on to my children. I hope.
Absolutely. Absolutely. You're absolutely true. That's the goal. And it doesn't matter which of these constitutional miasms you are. When you're doing everything that you just talked about and we're talking about, it doesn't, you don't automatically get, oh, I'm tuberculinic, I'm destined to be more ill. No, because you already know what the body needs physiologically to stay well. And so the way you get sick is predetermined, but it doesn't mean that you go down the rabbit hole and will never recover.
Right.
100%. And whether you're that or Loetic or psychotic or psoric, doesn't really matter what it is. That's what you got. This is how you're going to get sick when you get sick, but you know what to do, and you know what to do to prevent yourself from getting sick.
Right. Yeah, I think that's the key. Like you say, you know, it's prevention, it's taking our healthcare into our own hands. Yes. It's, you know, having agency over our health and our well-being. And that's key. And I can't stress it enough to people. You cannot go on in life just thinking you can eat and drink and do what you want and nothing will have consequences. It will have consequences. Don't get shocked when it does and expect someone to fix you. Do the fixing now, you know?
100%.
Yeah. So I have a few questions still, just very briefly, because I'm conscious of your time, but you do have, obviously, you're trained in dentistry, and you do have an element in the clinic where there is biological dentistry as one of the modalities. And I'm really interested in this. And, you know, that it was another missing piece. I think I'll always find missing pieces the more I go on. I don't think I'll ever stop finding them, but biological dentistry was a missing piece for me as well. And, you know, I ended up having a cavitation removed, and that was some process as well. But I'm interested in how you kind of integrate that into the treatments that people are having.
So biological dentistry is, you know, the thing, first of all, the teeth, as you know, like on Chinese medicine, is related to a different organ. You know, all the organs are on meridians in general. So, you know, with the contact regulation tomography, we actually get a reading of the teeth that are sort of susceptible, and I look at the organ systems that are involved with those specific teeth. So we don't physically do the dentistry anymore, obviously, but there are biological dentists in the area and around the country that people can be sent to for that. And so what ends up happening is that, you know, the tooth is a vital structure, a very vital structure. And, you know, if you have a tooth removed, extracted, and they didn't remove the periodontal ligament, which must have happened, we can assume that in time you would ultimately develop a cavitation because it didn't heal properly, because the periodontal ligament became a barrier for the proper healing of the bone once wisdom tooth or whatever tooth it was extracted. So that particular infection then basically has the ability to seed the rest of the body, you know, in general. And so if we don't remove that, it's like, you know, having a sliver in your bottom of your foot, and you learn how to walk differently without taking the sliver out. They said, take the sliver out, and your gait will actually improve. So if you do have a source of infection from a tooth, or some other issue that's related to the tooth, that we need to address that as part of the problem. Otherwise, it's just one of the things that keeps filling up your cup, and you're not doing anything with it. So it has to play a role. It has to be part of the big picture. And so dentistry in that way, and, you know, dentistry in the 1950s, 1850s, was separated from the rest of the body. And so it became its own specialty, which is unfortunate, because if you look
Isn't
at
that
somebody,
unfortunate with all specialties though?
Yeah, it's true. Oh, and one thing I didn't say about lymph, there's no lymph specialist.
True.
There's no lymphologist,
Yeah.
because there's no drug you can give for the lymphatic system
Yet. They'll figure out how to make one.
Hopefully never. Hopefully never. Hopefully we have to have people moving. So that's how dentistry actually plays a role, and how different teeth And I was like the eye tooth, which is the third tooth on each side, is directly related to your liver and your gallbladder. And I remember like years ago, and I'm still doing dentistry, 45 years ago, person came in and said, "Oh, this eye tooth is killing me." And I'm looking, I said, "There's nothing wrong with that tooth. Take an x-ray, say there's nothing, you have no cavity." It ended up, of course, it was their gallbladder. Their gallbladder was the problem, but they didn't have pain in their gallbladder. They basically had pain in the tooth, and vice versa. You could have pain in the gallbladder, but it shows up in the tooth, or pain in the tooth and it shows up in the gallbladder. And the same with other organs.
So it's part of your diagnostic process, and then you have kind of external people. Because my son last year, at the beginning of this year, actually, he fell at school and smashed out his two front teeth. And they're his adult teeth. And I keep worrying about what it's, going to do long term. He had to have them built up with composite resin. And I worry about the long-term implications of that, because what can I do at this point?
Well, there's that, how old was he when it happened?
8.
So, what we would hope for is that, and at 8, he's still growing. So the bone isn't rock solid, because when you're younger, when you're older, because I used to deal with a lot of hockey accidents here in Canada, the United States, it was in Canada then. If the bone bends and you don't snip off the end of the root, the blood supply, and it will recover just fine. And it won't be.
It didn't touch the root, thankfully, and it hasn't discolored. But I sometimes worry about it.
I would say that'll probably not be an issue if it hasn't. Good. How long ago was it? You said
about 6 months, 7 months.
Yeah, time will tell. But generally speaking, the longer it goes, the better it is. Yeah, per se.
So I just want to speak lastly about the clinic and your course that you run, because for anyone who's listening now, they're going, but where can we get this clinic? Because in the UK, I know of a few clinics doing different things and some really, innovative people and clinics, but there isn't anywhere yet that has everything in one place and all these modalities and all these, treatments that you have. It's quite revolutionary and amazing. I mean, I can only imagine what it costs to get all those machines and all those treatments.
A lot.
And therefore how much it costs a person to come for a week or 2 weeks. And I just wonder I don't even know what my question is here, but it's my objective. My biggest mission in life is to try and make this healing work more accessible to people, because most people can't afford those sorts of treatments. And I just wonder if you see this ever becoming more accessible and work like yours being offered, to more people.
I absolutely do. And you mentioned the course. So my next course that I'm teaching on all of pretty much everything I talked about as far as machines and modalities and testing is happening here in Scottsdale the first week of May 2025. It's 4 days. We start on a Thursday. It's Thursday, Friday, Saturday, Sunday. We go through, the individual usually comes on the Wednesday. They actually go through all the testing themselves. They do some of the machines. They get to see what it's like. Then we go through then each of the different pieces. I teach. This is what this tells you. This is what you get from it. This is what this machine does. We have nurses basically who can show you how to do it.
Is this for practitioners then who want to do similar clinics to yours, and you're training them on how to do that?
Yes, I'm training other doctors, practitioners to be able to utilize some of the tools. We do not expect people to build a clinic like we have unless you have a few $1 million to be able to do that, it's not going to happen. But if you go home with 2 pieces of diagnostic, one piece of equipment, patients will start to see, and then if you don't get it all, somebody else will have it. So, because obviously when we send patients away, we have to do is that find somebody in your town who has a sound bed or who has a flow presso or who can do IV therapy. That'll be a piece of the puzzle. How will satisfy some of these other ones? So I'm training doctors, practitioners to expose them to that. We expose them to the fact of where they can then find some of this equipment, whether you're in England or the United States or Germany or whatever country somebody is in. They basically are able to take it into their own local area. And the more that we have physicians and whether you call it a clinic or just a regular office that has a couple of different modalities beyond just taking a picture or doing a blood test, that's how it's. And so what's happening is people then come and say, where do I find somebody else who does this?
Mm.
And so the more patients start asking that, the more the patients start asking their own physician, why don't you do this test?
Mm.
And it's like, the goal is, so there are medical doctors that I've trained. There are chiropractors that I've trained. There are dentists that I've trained who all take a piece of the puzzle that they can apply in their specific part of the world that they can use without having to spend, hundreds of thousands of dollars to build a large clinic that's, 6,500 square feet that has all this equipment and diagnostics in general. So we run a very organized ship. We don't need 100 employees to run this. You can do it very efficiently with 2 people and the practitioner, which we've proven that can be done. We have a little more than that because Dr. Drobot and myself are the 2 docs in the clinic per se, and we run a pretty well-oiled machine, I'll say.
Yeah, so I've heard. And you also do courses to actually train practitioners in biomedicine.
Yes.
A 9-month course, is that right?
No, it's actually the biomed the so I do many things. I also do mentoring. I do mentoring of 2 groups. We meet twice a month. We talk about cases, and I basically share my experience with lots of things. So the word is getting out, and people are spreading out in Canada and the U.S. Per se, I don't have anybody across the ocean yet who's in the mentor group per se, but they're all over. They're in all kinds of different states, and they have different state laws, et cetera, et cetera. So we have the intense course that we teach. I do regular, podcasts. I do a podcast with my daughter every 2 weeks on a whole variety of different topics, related to health and whatever people are interested in talking about. I do regular seminars. So I have stuff on my website of seminars I've done in the past for people. So I'm trying to get people who are totally new to this approach to medicine. And this would include lay people who are just interested in saying, well, what is this biological medicine stuff anyway?
And people like that can, because you do, am I right in thinking you do have a course where you teach people how to use biomedicine? So,
yes,
or is that, yeah. So how long is that course?
That course is the 4-day course. That's the doctor course.
Oh, I see. Right.
Per se. So and then we're teaching them to go back. And in fact, literally in 2025, we're going to have a new website. We're going to have a specifically for people to learn about biomed and drainage as a way of supporting their health. And whether it's blogs or cases or all kinds of things, I'm trying to increase the educational aspect as much as I possibly can to as many different physicians. And of course, in our own practice, my patients are some of the best advocates. Because they're always telling somebody else, "Oh, you should go to that clinic, and they'll do this and do that," which is pretty much how all the patients show up. We don't really market per se because we don't have to. Yeah.
I was for some reason under the impression that you did a longer course that trained doctors and lay people on how to actually use your methods, and kind of become a biomedicine practitioner.
I don't. I do the 4-day intensive, and now we do regular follow-ups by mentoring and that type of thing.
Well, there we go. There's an idea for you.
Yeah, that's true. I mean, I would love to do that. I have plenty of information to fill a course, believe me.
Yeah, I'm sure.
To be able to do that. And, I've been teaching for almost 45 years now. So, yeah.
Well, I'll sign up as soon as you do
it. Fair enough.
I'm so grateful for your time and all your wisdom and your knowledge. It's been so interesting hearing about biomedicine and your very, very holistic approach. That's what holistic medicine is. That's what holistic living is. It's the whole person, and you're treating the whole person as opposed to treating the disease, like you say, which is obviously why homeopathy works so well with what you do, because it treats the person, not the disease.
Exactly. Yeah. I mean, we all start off, thinking that treating the disease is how people get better. But, after and it's why I think a lot of naturopaths and physicians get frustrated because they find their patients, they feel better, but they never really get better, because as soon as they stop doing something, their symptoms all come back. You experience that yourself. It's that now once you start, this becomes part, and it's not like it's like doing casserole packs or skin brushing or going for a walk every day or drinking enough water every day or eating well. It's like you don't think about it because you just do it because it's part of wellness. It's part of health. Yeah. And it's not like, oh, well, I think we'll go to McDonald's today. It's like, well, it's like if I have nothing to eat and I'm in an airport and that's the best you got, okay, we'll eat at McDonald's. It's not the end of the world per se, but it's not an everyday fare, type thing. It's what you do. My mother always told me so many years ago, it's not what you do on Sunday, it's what you do from Monday to Saturday that's more important. So
exactly. Yeah. So true. Such a great note to end on. And thank you so much. We'll put all your details and links and everything in the show notes so people can find you and the clinic and your courses and everything you have to offer. And thank you once again.
Well, thank you for the opportunity. It's been a real pleasure.
I hope you enjoyed this episode of Reconditioned. I am honestly so grateful to each and every person that tunes in. Thank you also for taking responsibility for your own well-being. You should know that just by choosing to listen to podcasts like this that further your well-being, you're moving more deeply into abundance consciousness. Now, don't forget, I have a bunch of free resources over at laurenvakneen.co.uk, as well as every recommendation you could ever need in regards to your well-being on the LV Recommends page, all categorized for your ease. Thank you also to our sponsors. These episodes would not be possible without them, so make sure to check them out and get some pretty awesome discounts on the show notes. And of course, make sure you're subscribed to the podcast so that you can get updated each time a new one is released. Thank you. I appreciate you.